Nettie, how are you?
I've been a little bit better.
Okay, tell me what's going on.
I'm having some knee pain.
Okay.
And it's really hard to walk.
Is it this right knee here?
Yes.
Okay, when did that begin?
I would say about a month ago.
Okay. Do you remember spraining it or any issue that might have provoked this?
Hard to tell. Being so busy all the time and running around, I just didn't pay attention. Then one afternoon I noticed that I'm limping.
Okay, all right. Do you exercise?
I do, yeah.
Okay, and how's exercise been since this injury happened?
Very hard. Upper body, and that's it.
Okay, have you taken any rest?
Yeah.
Okay, good. So I would completely rest that knee to the foot until we find out what's going on, okay?
Yes.
Great. So are you wearing any new shoes?
No, same shoes.
Okay, so it would not be an issue with shoes. Is it like a numb? Do you ever feel numb or tingly?
Pain.
Okay, so just pain. Does it radiate?
It does, kind of like towards the back of the knee.
Okay, so it's mostly in the back?
Yeah.
All right. And on a scale of 1 to 10, how bad is it right now?
About 4.
It's about a 4. Okay. And how bad is it when it gets at its worst?
8.
Okay. And is it worse at any time of day?
No, it's just worse. Like even at night, it wakes me up.
Okay. Do you have any allergies to medications?
Penicillin.
Okay. Okay. Any other changes in lifestyle in the last month? Did you travel? Anything like that? No? Okay. Well, I'm going to go ahead and take your vitals since it's been a while since I've seen you. And then I'll look at your knee joints and also your feet as well. Okay. So, start with your blood pressure. Can I use this arm?
Yes.
Right. Okay, that's 110/62, so completely normal. I'm gonna slide this off. Okay. All right. Listen to your heart and your lungs next. Just breathe normally for me for now. Okay. All right, only as one entity present. Listen on the bell side for murmurs. Very healthy sounds, no murmurs present. Listen to your lungs. If you don't mind just moving your arms a little bit. All right, take a deep breath in and out. Good. Deep breath in and out. All right, listen on the other side. Deep breath in and out. Deep breath in and out. Okay, sounds are normal. I'm going to grab your oxygenation. I could have your index finger. Make sure your legs aren't crossed. Okay. That is, heart rate is 87 beats per minute. Oxygenation is 94% at room air. So a little bit lower than what I'd like to see. And take your temperature. Okay. That is 97.9. Normal. Alright, go ahead and look at me and let me know when the light enters your field of vision.
Now.
Okay.
Now. No. 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 No.
Okay, good. Okay, now keep your head completely still and follow the light for me. Okay, very good. Any dizziness that you're experiencing along with this?
Yeah.
Okay, when does that occur?
What do you mean?
Dizziness?
When does it occur
Yeah.
in general?
Mm-hmm.
Oh, I had some dizziness now. That's what I meant to say.
Oh, so just now, but not in general.
No, I've never experienced that before.
Okay, that's a good thing. Okay. So I'm going to go ahead and move on to your feet, your knees and your feet, okay? So you can just stay right where you are. Okay. So first I'm going to do some simple movements with your knees and listen to how the joints are behaving.
Okay.
Listening for any creaking or popping. Okay. So you don't have to do anything on your own, just okay. Okay, now it's the left knee that you mostly have problems with, but this knee is sounding healthy, so that's a good sign. Alright, now I'm going to ask you to do some movements on your own. If you could lift and lower your legs slowly, just this one, just this one. Okay, as high as I can go. Go ahead and lower. Okay, good. And move it slightly to the left. Okay, and slightly to the right. Okay, very good. Now if you can move your knee up. Okay, and down. Alright, any pain doing that?
No.
Okay, very good. I'm going to go ahead and write that down. Alright, I'm going to grab a pair of gloves so I can just palpate the area. Okay. Alright, I'm feeling healthy. Joints And the tendons between the joints seem to be firmly in place. No dissension with the lower kneecap. A slight protrusion here. On the lower quadrant. But it does seem to be symmetric, so it could be just the way that your bones are aligned. Okay, go ahead and just raise your foot. I'm just going to feel underneath here. Okay, and no pain on this knee when I do those motions?
No.
Oh, okay. Okay. I'm going to go ahead and look at the feet now. Okay. Just palpating here. Okay, wiggle all your toes at once. Okay. Try to lift your big toe. Okay, go against my push. On your next toe, go ahead and try to lift it. Okay, third toe, fourth toe, fifth. Okay. A little bit of atrophy here, but that's pretty normal in the sitting position. Go ahead and try to push this leg out towards me. Okay, now try to bend it back. Good. Now try to bring it in towards yourself. Okay, now pushing it outwards. All right. I'm going to listen to your ankles now. Okay, go ahead and roll your ankles. Okay. Okay, keep going. Sounds are normal. Okay, let's do it again. Alright, you can go ahead and rest that. Okay, I'm going to be looking at the feet more in depth later. But for now, just visually, your feet seem normal. No lumps, bumps, things to worry about. Symmetric in appearance, but I'll be measuring them a little here in a little bit. I'm going to move on to your problem knee. Okay. Hearing a lot of noises I don't like. Sounds like the joints are very inflamed. I feel also hearing a throbbing, which means there's a lot of pressure and blood flow pulsating in the area, which means that it's under some stress. Especially in this area. Just going to palpate. Does it feel painful when I touch this part?
Yes.
Sorry.
That's okay.
painful here beneath the knee?
Yes.
Okay. Go ahead and try to lift your knee in the air. Go against my push. Your right knee only. Good. A little bit weaker than the left. Try to bring it in towards yourself. And outwards. Okay. I'm going to raise your leg in the air. Try to lower it. Now try to raise it in the air. Okay. Definitely seeing some swelling here. Okay. I'm seeing that perhaps the knee became misaligned when you were exercising, perhaps. It seems it's very disconnected. The higher part of the calf is detached from the lower section. The tendons are still attached, so it doesn't seem like an issue that would be a broken knee, but you do need a lot of rest and therapy, so I'm going to look at the general appearance of the knee. Okay. Some redness here, but that's what I expected to see. Okay. I'm going to do some measurements here. Okay. Go ahead and lift this knee just very slightly. I'm just comparing symmetry to the other knee. Go ahead and lift that. Okay. And measuring the bottom of the kneecap all the way down to the ankle. Okay. Okay. So there's a little bit of variance here. This one. To the midsection, which goes a little lower. And seeing some asymmetry. Okay. Okay. That's it. And so the left knee is definitely more symmetric and uniform in shape than the right knee. Okay, go ahead and keep your eyes closed. I'm going to be touching one of your knees with an object. Let me know if you feel the sensation on your left or your right knee, okay?
Right. Left. Left. Right. Right.
I'm going to be drawing it all the way down from your knee to your ankle. Let me know if you feel it all the way.
Yes.
Okay.
Yes. 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 Yes.
Okay. I'm going to be doing a motion once, twice, or 3 times. Say 1, 2, or 3.
2, 3, 2, 1, 1, 3, 1, 1, 2, 1, 1, 1.
Okay. So those are just some basic sensory tests. You passed them, so you're not having any neurological issues with your knee. I'm going to have you lay down so I can take a better look at your feet and also do some movements of the knee to see if we can get it feeling better. Okay? I'm going to take an initial look here with the pen light. Looking at the skin surface can tell us a lot about what's going on underneath in terms of inflammation. Okay. Not seeing any purpling or redness. No significant swelling. No steatosis. If you look clean and healthy, don't see any lesions, warts, no fungus. So it's a good place to start. Okay. Checking for any debris or moisture that may build up at the tip of this tongue depressor. Do you ever have excessive sweating of the feet?
Sometimes, yeah, especially in the morning.
In the morning, do you wake up with very sweaty feet?
No.
So after you wake up?
Yeah.
Okay. And seeing some moisture build up and just a little bit of clamminess here. Okay. Not so much on the top. Okay. And definitely some more sweating on that left side. doing a moisture reading. Okay. Actually, this is normal levels. Let's try the other foot. Okay. So the left foot is a little bit higher in moisture. Usually it's best to have both sides symmetric in this quality. So I'm just going to take note of that. I'm going to apply an antiseptic spray, an ointment for the body that's going to help decrease any swelling and moisture that you're having down there. And it just helps with general inflammation. That's because I'm seeing some of this inflammation of the rise in muscle mass and some swelling right in the forefoot beneath the beginning of the metatarsals. So I'm just trying to really make sure that we take care of that. Okay. I'm going to be mixing it in with some other ointment just for sore muscles. And mixing it with the other leg, the other foot, I mean. Okay. Okay. I'm going to do some measurements to see if the symmetry is a little bit better. A little bit. Yep. Okay. Okay. I'm pretty pleased with these results so far. Just gonna see here. The skin seems even and elastic. Okay. Just going to apply some pressure point therapy before I move on to just some very gentle knee adjustments. Okay. This helps to circulate blood flow. Okay. Next I'm going to do a gentle knee adjustment, and we'll go ahead and talk about how that went for you. Okay. So I'm going to be lifting your right knee. Go ahead and place it here. I'm just going to be stretching it. Okay. I'm doing some very light rotations. Okay. All right, go ahead and lift this one. Doing some rotations again. Very gentle. All right, and lastly, I'll just be doing some pressure point therapy to the knee area. Okay. All right. I think this concludes our exam. Do you have any questions?
No.
How did he feel?
It feels a little bit better.
That's really good.